Alright, so being stealth, what does that mean? So most people would probably define it as hiding the fact that either you are transitioning or that you are trans at all. Whatever that may mean to you, I'm going to be talking about being stealth with your actual medical transition, your medications and such. Because I know that there are plenty enough videos out there by trans folks themselves saying, here's how I was stealth and everything at home, at school, whatever. And in general, they're talking about how they dressed, acted, what they talked about and things like that. But there are some things that I noticed that have gone wrong with patients of the clinic that I figured maybe I could make a video about and people could learn from other people's mistakes and how they go about getting their health care and avoiding having other people find out about it. Because there's just some very simple things that you can do that I guess people just it just doesn't cross their mind. So, I mean, of course, if you're living at home with your parents, things are going to be a hell of a lot more difficult to keep silent about if you're there in that environment. Not impossible. I do have many patients who are living at home with either parents or roommates or someone who is not supportive or they don't know how they'd react or whatever. And so, the usual stuff would apply if you are extreme stealth, which is basically what I'm going to be dealing with in this video. Not just, well, I don't really care if these people find out, but if they do, well, it'll just be a pain in the ass for me to deal with at that time. No, this is for the people who are like, no, it's probably going to be dangerous for me in some way, shape, or form if I get found out. So these are people who absolutely want no information about themselves found out by a particular person or whatever. So, I mean, of course, if you're living in a situation where you don't want the people you're living with to find out, you're going to have to do some basic measures. You're probably going to have to be using your incorrect pronouns and, and your dead name and stuff like that. And I mean, it's hard not to slip up sometimes, and if you have friends come over, you want to brief them before they get into it and, tell them, hey, I don't want this person to know, so we're just gonna do the whole dead name thing and the incorrect pronouns and all that. So, I mean, all that basic stuff is things that are covered in other videos, so sorry about, boring you with that. But some things that I've noticed, people that get their medications and they bring them home is, they just leave them out. Honestly, I don't know how you make that kind of a rookie slip up, but it does happen. So, don't think for a second that if you just leave a paper towel over your medicine or something that some jackass isn't going to come in there at some point in time and lift the paper towel or whatever. Same goes for if you put it in just the top drawer of something or one of those mirrors that opens up and it's like a medicine cabinet in the bathroom. Never assume that someone isn't going to come into your personal space, because they do. Because they're people. I don't care if it's your parents, your roommates, or whatever. Unless you got locks on shit, it's gonna get gone through at some point in time, because whether they're doing it maliciously or they're drunk or high or bored or on a dare or whatever, it's gonna happen. Just anticipate that. You need to put your medications and information regarding you being on medications in a locked down space, or a space where conceivably one would not be going through unless they were doing it for a malicious reason. I mean, if you stuck your medicines, I don't fucking know, if you cut a slit in your underside of your mattress and stuck them up in there and someone discovers them there, they are actively going after you. It's not just I'm randomly going through, that kind of a situation. Probably you would have known ahead of time that you're living with someone who is that malicious, but whatever. At any rate, if you're going about hiding stuff, get a little lockbox or something and put the lockbox in a place where someone can't just easily stumble upon it. Put it up in the top or bottom, whatever, of a closet and put something on top of it, or put it in the back of a drawer stuffed over with clothes or something, and then it itself is locked so that someone, even if they find it, I mean, what are they going to do if they bust it open? Well, I mean, again, malicious person, and probably nothing that you do would actually be safe unless you like buried it under a shrub in the yard. I don't know. But anyway, so you really got to be careful where you're placing your medications and any paraphernalia related to medications. You know, you don't want to, like I give my patients a PDF file to print out for their labs. You don't want to print that out and then like just leave it sitting on your desk. You know, I mean, it doesn't say specifically like, I'm on hormone therapy on those orders. But it doesn't take a freaking genius to look there and see that you're getting an estrogen level, a testosterone level, blah, 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 that maybe something's going on. So, you know, just things like that. Have a little sense. People are people. They're going to go through your shit, whether you're, you know, thinking they aren't or not. They're going to go through it. Like, it's just a thing. I've seen this over and over with patients that have told me that this has happened, that I never thought that my roommate would actually go in my room, but they said they were looking for a shirt, and so then they're in my desk drawers and stuff. No, people are people. Protect yourself against people. Anyways, that may or may not always be possible. You may have to keep your medications off the site. You know, you may have to keep them at a friend's house. You may have to, I don't know, rent a P.O. box at a post office or something like that to keep them in a safety deposit box at a bank. You know, that's a little bit extreme, I know, but hey, you know, you gotta do what you gotta do. So hide your shit, basically. Anticipate that people are going to be looking through your stuff. Yeah, it's just basic stuff. If you're at home especially, but also if you're at school, you know, college, whatever, the pharmacy you use is very important. Do not use the pharmacy that your parents use. Are you kidding me? Come on. This happens so often. I mean, it's not even funny, actually. It happens so much that the person is just familiar with that pharmacy, and so they just go with that one, thinking, well, I mean, there's no chance that I'm gonna cross paths with mom and dad. That part might be true, but I'll tell you what happens more often than not. Let's say you use the Walgreens that's just right down the street from your house because it's easy to get to, and that's the same place that your family goes to. Well, especially if you've ever had that pharmacy used as a child, then you definitely want to look at what contact information is on file for you, because a lot of people get started and their very first prescription gets filled and the only phone number on file at that pharmacy is from when that person was a teenager, when they got like an antibiotic or something, and it's their parents' number. And so then the pharmacy calls the parents' phone number to say, hey, your prescription is ready for pickup. Yeah, that goes about as well as you would think it would. Also, address on file. If you put your home address, okay. Might want to ask that pharmacy, do they ever send out flyers? Do they send out any kind of mailing or anything? Because there's the other possibility, especially if you have someone who might go through your mail or someone who is overly suspicious. You don't want them going like, why are you getting stuff from a pharmacy? You're not even on any medication, right? Nah. Anyways, so contact information, be damn sure you have it changed back and forth at the pharmacy you're going to use. I still don't advise, even if you go through all that, I still don't advise using any pharmacy that your parents have ever used. Ever. And here's the other reason. So, there are some pharmacies where they don't have a high staff turnover. Nowadays, there's usually a pretty high staff turnover at pharmacies. But anyway, at pharmacies that don't have a high staff turnover, these staff members may have seen your parents come in and out every month, and they kind of know them on site. And then they're going to put two and two together eventually that you are their kid. And when they do, they may, out of maliciousness or out of ignorance, say something to your parent like, oh, I saw so-and-so in here yesterday. To which then the parent is going to be like, why? You know, and I mean, the HIPAA kind of protects medical information, but just the fact that now your parent knows that you're going to a pharmacy to pick up something, that could set them off and, you know, start whatever. If they're smart, then they would know they could just call the pharmacy, pretend to be you because they know your date of birth and everything, and just ask, hey, when was my last prescription? What was it again? So, I mean, people that want to be devious can be devious. So use a pharmacy that they are not going to be going to. Because I can guarantee you at some point in time, you're going to get a phone call, or they will have someone say something to them while they're there. Just don't. Avoid that entirely. Make the extra drive, go somewhere that maybe isn't as convenient. If you're trying to go stealth all the way, you just got to make some time sacrifices there to be entirely safe so that they don't find out. Let's see what else is on my little notes. So also that would go for where you get lab work. You may be looking around for some place to get labs done, and you're like, oh, hey, mom always goes here, especially if you try and get your primary care doc office or an urgent care that you have been to in the past with your parents, or that you know that your parents go to. Same thing can happen. Just don't. At some point in time, some piece of information is going to get crossed. Someone's going to get called or get a piece of mail, or they're going to call up there and pretend they're you, or whatever. Like I said, just don't. Find a place that they don't go to. It's not that hard. Like, it's really not. And if it's our clinic treating you, we will help you try and find like a different place to go if you're just completely clueless. I mean, go online, labs near me, or LabCorp locations, or Quest Lab locations, or other urgent cares, or whatever the case may be for however you're getting your labs. Find a different location, or you will get found out. I can just 100% guarantee it. Happens so often, it's just wow. Anyways, a similar thing can go for insurance. So if you're on your parents' insurance, be careful. Do not give that insurance information to the pharmacy or the place that you're getting labs from if you don't want the insurance being used, because I can tell you what happens when you use that insurance for something is that they will send a statement. It's called something like benefit summary. Usually insurance companies will send that out by mail or by email once a month or so, and it details everything that was used that month for that insurance, and it will say what labs you got, or what medicine and where you got it at. So I mean, cash is usually going to be the way to go. Cash or credit. Don't use your insurance. If you don't know of low-cost lab options, like, we can tell you about them. Your provider should be able to find you some low-cost stuff, just so that this doesn't get put on the insurance claims, so that then your parents basically will get a notification of, oh, look, here's what's going on now. I mean, it's just like they don't even have to investigate. They'll see it all right there. It's just, like I said, this is like stealth 101 for medicine. Like, if you're on your parents' insurance, do not use it if you don't want them to know about it. And I would definitely double check, let's say if you go to a Walgreens, one of these companies that's a national company, or CVS, or one of those, Walmart. So let's say you go to Walgreens. Let's say that, your parents used a Walgreens before for you. The Walgreens and, the CVS's and the Walmarts and all those are connected in a system. So there is a decent chance that if you go to some other Walgreens thinking, at least this one's far away and I haven't ever seen them go here, there's a decent chance that the person who gets your prescription order over there is going to go in their system and see that you have insurance on file at another place, and they're going to just pull that right on over and use it. So if you're choosing to use a national chain pharmacy of some sort or something like that, you really might want to call ahead of time and make sure that they have nothing on file, and tell them, I pay cash for my medicines. I don't want insurance used at all, so that they are very clear about that. Because that's another thing I've seen happen, where someone thought that they would just go to another, CVS or another Walgreens and that everything would be okay, but they were on their parents' insurance and their parents had been using Walgreens or CVS or what have you at another location, and that insurance information got pulled over to the other location that they were now using, and ta-da! A month later, the benefits summary came in the mail, and parents are like, what the hell is this? What prescriptions are you picking up for estrogen? What? Okay. Anyways, so like I said, I mean, you have to be very careful with this stuff and think it through if you are wanting complete and total stealth and you don't want any of those people finding out. Let's see. So I think that pretty much covers it for insurance. Insurance is just don't freaking use it if someone is on it with you that you don't want them to know about your transition, like period, because they can find out. Even if you intercept the mail and you rip up that summary of benefits, doesn't matter. They have access to it online. They may get it emailed to them even. So I mean, they'll find out eventually that way. Let's see. Work and school and just out in society in general, there's loads of stuff there. I mean, if you are out in one section of your life, and not out in the other, just know that that is the risk you take. I mean, it just is. I'm not saying that anybody needs to shutter themselves up in a box and absolutely not be out ever. But always be aware of whoever or whatever you share that information with. There is the possibility that that could then somehow interact with this other part of your life, be it, work or school or whatever. So, I mean, you do need to have those kind of things, kind of thought out. Who knows about you? Do they know that you are not out to anyone except for this small little area, piece of your life or whatever? If you're having people at work use your appropriate pronouns and your parents or your roommates or someone come and visit you at work, what do you think's going to happen? Or if they call up there to talk to you and the person says, yeah, let me go get her or whatever, and they're going to be like, her? Anyways, so I mean, you want to be careful where your areas of your life might intersect and let people know so that they are prepared. Because I mean, the people that you are out to are going to mean well, and they're going to try their damnedest to address you as you have told them to, and they're going to try their damnedest to do it to everyone, unless you tell them that they don't need to do that with everyone, So be careful with that. I know it's great to get that affirmation and that love and support from friends and potentially family or coworkers or classmates, but just know that the more people who know, then the more people who know. And if you haven't explicitly told them not to let other people know, they're pretty proud that you trusted them with this information, and they're like, they want to utilize it in a good way, usually, but let them know, clue them in. I have had a couple of people ask, one patient recently had said something, they go to a school that is a predominantly Christian school, nothing, I'm not here to debate Christianity or anything, but an awful lot of people out there use Christianity as a kind of a flag to be a bigot, and it's just ridiculous. And this particular school, not too keen on the LGBT scene. So so they were just wondering, what can I do? What if someone saw me with my medication or something like that? I have a couple of answers that you can tell people. It may not hold up if the person works in an endocrine specialty or something, or if they can actually remember what you said and fact check it down to the finest detail. It would not work with your parents. These excuses that I'm about to say would not fly with your parents, because they would wonder when you had been diagnosed with these medical conditions and hadn't told them and stuff like that. Next, let me cut in here and discuss what you can say is going on if someone catches you taking your medication. So let's do those who were assigned female at birth first. So these are folks who are going on masculinizing therapy usually. Testosterone would be the main thing. So let's say they're going on testosterone and they have their gel, their patch, their injection, their what have you. And a school official comes around a corner and sees them. That sounds really weird. They come around the corner and see them sticking a patch on. What the crap? Anyway, or they find the medicine in their dorm room or bedroom or what have you. So they find it and they say, hey, why are you on testosterone? Well, here's a really good answer that won't hold any water with your parents probably, because they would wonder why they didn't know that you had this medical condition. But anyone else who, didn't raise you from birth is not going to be able to question this. Just calmly say, I have androgen insensitivity syndrome, and so I have to supplement with testosterone, and move on about your life. For those who don't know, androgen insensitivity syndrome, maybe a misnomer there. A lot of people have a problem with that name, being it calls it a syndrome and whatnot. This is more of an intersex development. And so the intersex community is usually where you are going to find this. And what happens is essentially, I know this is just a crap way of explaining it. I apologize to anybody out there who is intersex and just is like, oh my god, this idiot, listen to this. Anyway, but essentially, for those who are just getting to know androgen insensitivity syndrome, it is when someone is born with a genetic disposition towards, it would look like they had an XY chromosome or whatever. So all those out there who are like, XY is male. Well, actually, what usually happens with people who have androgen insensitivity syndrome is they may have an XY chromosome pattern, but they actually are insensitive to androgens, which are masculine hormones, and so they don't develop how those who are usually assigned male at birth would develop. So they can have, all the genitalia of those who are usually assigned female at birth, and they could be assigned female at birth and usually are. So then they grow up and they develop very feminine secondary sex characteristics and everything, because even if their body has androgen production, or if they have, the gonads to produce testosterone, they're just not sensitive to it. And there's varying degrees of this that can happen: complete insensitivity, incomplete, partial, whatever. But the point is that with certain types of androgen insensitivity syndrome, giving testosterone is part of the treatment plan. So you could appear feminine, but be on testosterone supplementation, and this gives you an excellent excuse for those who are not entitled to having any more of your health information than what you are willing to give. Because obviously, you're not going to be able to whip out a a lab result where you were diagnosed with this, but for school officials and stuff, or a boss, or a friend or a roommate or somebody who you need to give an excuse to, this is an excellent excuse. Because people who have androgen insensitivity syndrome generally, by and large, are going to have been raised in a female manner. So, and they're going to have body fat distribution and patterns of a female nature. So at any rate, this is an excellent excuse for you to give to anyone as to why you are taking this. Sorry if this explanation was overly long. I was trying to be very, sensitive to those who are in the intersex community. I'm very well versed in trans culture. I'm in it. But as far as intersex culture and whatnot, I am not. I humbly put myself before you. Give me corrections on how you would like this to be termed and everything, because all I have right now really is the medical terms and whatnot, and I know those always fall flat on their ass whenever it comes to calling people something. It's just ridiculous. Just to clarify, my opinion is difference of development. Everybody develops differently as a human being. It's nothing that's wrong with anybody, but it is a very convenient thing for transgender people to say, who are transitioning masculine, is to say, I have androgen insensitivity syndrome, and therefore I need to supplement with testosterone. So apologies to the intersex community, but here I am, trying my best. Anyways, be aware that school officials may be entitled to know about your vaccine history. They may be entitled to know about, have a physical performed just to say that you're in good general health, but they have no right to get into your other health history of conditions you may have, such as androgen insensitivity syndrome. So if you tell them that and they're like, well, I need this documented, why? You don't have a right to that piece of information. That has nothing to do with getting accepted into school and all this. That's like more health information than what you are entitled to. Now, if it's a privately funded Christian or what have you, type college, they may have something written into their actual like bylaws or whatever that says something to the effect that they could kick you out for any reason, and if you refuse to provide that, blah, 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 blah. But anyway, for the vast majority of cases, saying androgen insensitivity syndrome is probably going to get people to back the fuck off. So, as far as those who were assigned male at birth, who are transitioning more like the feminine direction, whether it's non-binary or full femme or whatever, this is kind of a suck thing to say, and I'm sure I can come up with something better if I think about it long enough, but I mean, this would definitely get people to back the hell off of you if you tell them, they're like, hey, wait, you're taking estrogen. Why are you taking estrogen? Tell them you have prostate cancer. People of all ages can get prostate cancer. Kind of sucks to say that you have that, but that would definitely get people to shut the fuck up, don't you think? But anyway, so I mean, people with prostate cancer, they need to knock down their testosterone. And so how do you knock down testosterone? You can do it through T blockers. You can do it through estrogen therapy. There you go. That's why you're on estrogen therapy, because you are dropping your testosterone levels by elevating your estrogen levels. Da, da, da. Anyways, I mean, it really does suck to say something like, oh, I have prostate cancer or whatever. I mean, you could say that you have some type of prostatic disease, maybe, instead of prostate cancer. And so, just be like, oh, I have a disease of the prostate that is driven by testosterone. And so in order to control it, I have to take estrogen supplementation. So that might be something that's a little bit less creepy to say than I have prostate cancer. But anyway, it is something that you can say that is a valid medical reason for taking this. People with prostate cancer do get put on usually low-dose estrogen therapy because they can't have testosterone, and they do need some kind of hormone to even feel good, or else they feel like shit. So that is a real thing, estrogen supplementation in people that have prostate cancer or something like that. So anyway, that's an idea as well. Anyway, so this video went on a lot longer than I thought it would. I hope people found it interesting. I know I kind of droned on a little bit, but, the main thing is, if you're trying to be extra stealth, you really need to think about all aspects of your life. Like, don't just jump into it and figure, you'll be able to make up an excuse or come up with something or whatever. Think ahead, because I'm here to tell you, the people who mean you ill will, they're already trying to think 3 steps ahead of you, so outsmart them. Anyways, hope everybody's doing well. Stay safe and stay educated.